a mother to be excited about her pregnancy, only to face a sudden health challenge, either a chronic disease affecting her nervous system or unexpected emergency threatening her baby's life. Today, we will discuss conditions that impact pregnancy in very different ways. This includes multiple sclerosis, or also known as MS, and next is cord prolapse. While MS is a long-term neurological condition that can affect mobility and daily function, cord prolapse is a life-threatening emergency that requires immediate action to save the baby. Let's explore how these conditions affect pregnancy, how they are managed, and most importantly, the role of nurses in ensuring the best possible outcomes. Now, what is multiple sclerosis? Multiple sclerosis is a chronic autoimmune disease where the immune system attacks the myelin sheath, which protects the nerve fibers. This leads to muscle weakness, fatigue, vision problems, and cognitive issues. Multiple sclerosis, or MS, is a progressive disease of the central nervous system in adults, affecting around 2.5 million people worldwide. MS affects the ability of nerve cells in the brain and spinal cord to communicate with each other effectively. Nerve cells communicate by sending electrical signals down long fibers called axons, which are contained within an insulating substance called myelin. Evidence suggests that MS results from an autoimmune reaction in which a malfunctioning immune system produces T cells that react with and damage the body's own cells. In MS, an unknown trigger activates helper T cells. This enables the T cells to adhere to and cross over the blood-brain barrier, which normally prohibits the flow of substances into the brain. Antigen-specific receptors on the surface of T cells recognize central nervous system myelin as an antigen. The T cells attack the myelin that surrounds the axons. This causes the central nervous system to lose some of its ability to send signals throughout the body, causing the debilitating symptoms of MS. MS in pregnancy. The good news is that MS does not affect fertility, and many women experience symptom relief during pregnancy due to hormonal changes. However, fatigue and mobility issues may worsen, increasing the risk of falls. Let's move on to diagnosis and treatment. MS is diagnosed through MRI scans and neurological exams. However, some medications are unsafe during pregnancy, requiring alternative symptom management strategies like physical therapy and lifestyle modifications. So as nurses, we play a key role in monitoring neurological function and mobility. Second is implementing fall prevention strategies. And last but not the least is educating patients about postpartum relapse risk. Now let's talk about umbilical cord prolapse. Umbilical cord prolapse is a critical obstetric emergency. This occurs when the umbilical cord slips into the birth canal before the baby, where it can become compressed by the baby's head or body, cutting off oxygen supply. This condition is more likely in pregnancies with breech presentation, excess amniotic fluid, multiple pregnancies, or premature rupture of membranes. Next we have is the classification of cord prolapse. First is overt umbilical cord prolapse. This descent of the umbilical cord past the presenting fetal part. Second, we have the occult umbilical prolapse. Descent of the umbilical cord alongside the presenting fetal part and has not advanced past the presenting fetal part. The third, we have the phonic or cord presentation. The presence of the umbilical cord between the presenting fetal part and fetal membranes. The cord has not passed the opening of the cervix. Next is the complications and emergency management. When the umbilical cord is compressed, oxygen flow to the baby is reduced or completely cut off, leading to brain injury or even stillbirth if not treated immediately. Next is diagnosis and treatment. Diagnosis is based on a sudden fetal distress or detecting the cord in the vagina. Emergency interventions include first, repositioning the mother to relieve pressure. Next is manually lifting the baby's head to reduce compression. Third is providing oxygen to the mother. And fourth is performing an emergency C-section to deliver the baby.